Hi, this is Ruhie, and I'm here with my grandma, Pratibha Nirgudkar, who was a occupational therapist.
Hi
So,
Ruhie.
okay, here are some questions I have about your job. What what is an occupational therapist?
So, occupational therapy is a global health profession which mainly focuses on assessment and needs of the patient and help the patients to do their normal daily living activities.
What did you do for your job?
When I started working in India, I also worked with the pediatrics, where all the outpatient polio cases used to come as an outpatient. Then after coming, then I worked in the general hospital and worked in different wards like cardiac, surgical, medical, mental, and because occupational therapy is encompasses a lot of aspects of the life and peoples of all ages, starting from the kids to elderly people.
Okay.
So
What are outpatients?
outpatients is the facility where the patients come to receive the treatment and then they go to their home. So that is all outpatient. And inpatients is when the patients are admitted to the hospital and then you go to different uh, floors where they are admitted. You go to their room and provide the treatment. Or you can bring them in the wheelchair to your room that is assigned for you, where you have different modalities, exercise equipments, and you treat them for an hour and then you send back to their
Okay.
bed.
Which area did you mainly focus on?
I really enjoyed working on a stroke floor. The stroke means when your one side of the body is paralyzed, and then the occupational therapist role is to help you to get that motor control, sensory control back to the side which is involved, or sometimes the damage is so much that the side cannot improve, then you train the patient in changing their dominance to the left side or right side, depending on what their side is affected. So I really enjoyed working with the stroke patients. I also worked with the cardiac patients. I worked with the patients on the ventilators in the respiratory hospital, and I had really fun coming up with a lot of different techniques and doing some different projects, especially on breathing, and help them to reduce their anxiety and stress level.
What do ventilators do for patients?
The ventilators are the outside support system to help them breathe if they are not able to breathe on their own, and that usually happens when your lungs start failing and they have to put you on the machine that is called as a ventilator, and you are kept on that machine for some period of time until you can breathe on your own again.
How did you doing your job help make an impact in this world?
It was where the in my profession I had so many patients I came across where I could help them to recover and lead their normal life, going home and doing their own normal daily activities. So it was very rewarding for me. I even work for the patients at home, like home health, where you go to a patient's home and work in their home and come up with these practical solutions to help them to do their daily activities. And
What was the most rewarding thing that you got out of work every day?
everything what I did to help the patients and interacting with different kind of patients, different levels of patient, different backgrounds, people come from everywhere, and I really enjoyed interacting with them, connecting with them, understanding their problems, and coming up with solutions, practical solutions, and to help them recover. And when somebody responds to your treatment, they you feel really nice that you have done your job, and it is a very self-satisfying and rewarding. And you, so I, from very beginning, I had the aptitude for going for the health. I wanted to be a healthcare professional.
Okay, how long did you work for?
Actually, since I graduated, many years I worked in India, and then in this country about I would say I worked for 30 years. So
Okay.
total
Where
of
did you graduate from?
I graduated in India, Mumbai. Mumbai is the capital of Maharashtra, and there was a GS Medical College where I completed my occupational therapy course, and I started working in the hospitals right away.
Okay, how long did you study for to
Actually,
become
occupational
a...
therapy, you have to study for 4 years, where you study all the subjects like related to your body, anatomy, physiology, surgery, medical, all the subjects, mental health, psychology, pathology, pharmacology, all these subjects are included in your study. And in any other medical school program, you have to really work hard to understand that. And we had actually the able to work with the patients when we were students. So we had to attend the rounds of the doctors, and we were work with in close connection with the doctors.
What did you most enjoy at work?
I really enjoyed everything what I did. You know, there was not a single job where I worked. I did jobs in various different setups with different hospitals, but there was not a single that I can say that I had to force myself to go to work. Every day I enjoyed going to work because it was very rewarding for me to help the patients, and that was my goal, to be able to help.
Okay, thank you. This was very good, and
You're
I will
welcome.
see you.
Yes.
I'll see you all next month. Okay, bye.
Bye.